awareness from Icmfel on malaria and Chagas disease. Last week we talked a lot about malaria. Today we have joining us members of Icmfel, the medical students. So this week we have our medical students creating awareness on Chagas disease. So we're gonna be having student Dr. Flomo and student Dr. Christopher joining us all the way from uh, St. Elizabeth, Jamaica, and they're going to be carrying us through the awareness of Chagas disease today. You're welcome to join.
Did you know that there's a deadly disease that affects over 6 million people? It's not well known. According to WHO, this disease is called Chagas disease, which is also known as American trypanosomiasis. Hello everyone, my name is Diana Christopher. Welcome to International Christian Medical Fellowship. Last week we talked about malaria, and this week we're going to be talking about Chagas disease, which I'm very much excited to talk to you about. Chagas disease is an infectious disease that's caused by parasite Trypanosoma cruzi. Note that during the course of this presentation, you'll be hearing me saying T. cruzi. Don't be confused. T. cruzi is the same thing as saying Trypanosoma cruzi. This parasite mostly exists in Latin America. It transmits to people through insect vectors. Note that if the disease is left untreated, just like any other disease, it is life-threatening. It has mostly been transmitted to humans by contact with feces or urine of triatomite bugs, also known as bugs. Now let's take a look at the causes and how Chagas disease is transmitted. Triatomite bugs, which are the main vectors of Chagas disease, is spread through vector-borne transmission. Now there's an interesting thing about these bugs I find funny. They spend their day chilling in the holes, walls and roofs during the day, and then at night when people are asleep, they come out, crawling out of their beautiful tents to disturb. So they mostly have the propensity of biting the faces of people and then drink the blood. When parasites from the bug feces enters the body through mucous membranes or skin bricks, the person may become infected. Individuals may unintentionally scratch bite marks, eyes, or mouth. People also can become infected through congenital transmission, that is, from a pregnant woman to her baby. Blood transfusions, organ transplantation. If a mother has Chagas disease, it is generally regarded as safe to breastfeed. But if the mother has bleeding nipples, she should pump and discard the milk until the bleeding stops and the nipples fully recover. Chagas disease cannot be spread from one person to another, like the common cold or flu, or by casually interacting with infected individuals or animals.
Moving on to signs and symptoms. The signs and symptoms in Chagas disease develops in 2 stages. About 2 months after infection, the initial acute phase ends. A large number of parasites circulate in the blood throughout the acute phase. In the acute phase, sometimes the signs and symptoms are often minor and can include fever, headache, vomiting, enlargement of your liver or spleen, rash, eyelid swelling, body ache, fatigue, loss of appetite, swollen glands, and etc. In the chronic stage, the signs and symptoms may include irregular heartbeat, heart failure, sudden cardiac arrest, difficulties swallowing due to enlarged esophagus, stomach pain, or constipation due to enlarged colon. Moving forward to diagnosis, blood tests can determine whether the parasite or the antibody your body produces to fight the parasite are present in your body if you show the obvious signs and symptoms. Tests may be carried out to identify whether the condition has progressed to the chronic stage and lead to problems with the heart or digestive system. In the diagnosis, testing might involve an electrocardiogram, which is a test that records your heart's electrical activity, a chest X-ray, which is an imaging test, and it allows your doctor to see if you have an enlarged heart. An echocardiogram test is done. This test uses sound waves to capture moving images of your heart, which allows your doctor to see if there are any changes to the heart or its function. An abdominal X-ray is also carried out by your doctor to capture images of your stomach, intestines, and colon, and an upper endoscopic test to also examine the esophagus.
Now, having looked at all these signs, symptoms, diagnoses, causes, and its transmission of Chagas disease, I'm sure we are all wondering, what's the treatment? Chagas disease treatment focuses on eliminating the parasite and managing the signs and symptoms. The prescription drugs are benznidazole and nifortimox, also known as Lampit, and it may be useful for treating Chagas disease while it's still in its acute stage. Only the Centers for Disease Control and Prevention are authorized to sell the medications in the US. The drugs won't be able to treat Chagas disease after it has progressed to the chronic stage. However, they might be able to stop the development of the condition, and it's most likely to infect, and the medications might be prescribed to those under the age of 50. The individual signs and symptoms will determine what extra treatment is necessary. Heart-related complications, for example, treatment may include medications, other devices to control your heart rhythm, surgery, or even a heart transplant. For digestive-related complications, treatment may also include diet changes, medications, corticosteroids, or in severe cases, surgery. And defecate. I know you must be wondering, after talking so much on Chagas disease, how to prevent them. Don't worry, I got you covered. These actions could assist you in preventing Chagas disease and where it's most common. A mud or a thatch hut should not be used in sleeping. Why? I'll answer your question. Because tritamine bugs are most common in this type of home.
And if you live in a thatched or mud home, cover your bed with an insecticide-soaked net.
And lastly, for skin that's exposed, apply repellent.